Thank you, Tracy. Good morning, everybody. So I work with Tracy, I'm with the HSE, and it's a very positive experience working in partnership with all of the different stakeholders who are involved in this project, and it really shows the strength of people coming together to get something like this, something big, a big project of work over the line. So in the HSE, our focus will be on responding to the findings. So what are the findings telling us? What are our priorities at every level of the organisation, at hospital level, at group, regional level, in terms of the different geographical spaces across the country? There may be different priorities down the west compared to the Dublin area or the south-southwest. So what are those priorities, and how do we respond to them? How do we work in partnership with patients? How do we work in partnership with staff across the system to identify the solutions and prioritise the issues, and demonstrate to patients in a very public way how we are responding, listening and improving to feedback received from patients? Because this is where we fall down. You can walk right across any hospital service in the country in Ireland, and it's not obvious to people walking in the door how we listen to patients. It's not obvious how we respond to what patients are telling us are important to them. But improvements are being made all of the time, but we're very slow at profiling what they are and how we've listened and demonstrated that we're listening all of the time. So at national level, we'll have a national report on the general findings. We will have regional reports, which I'm not sure if you're familiar with all of the hospital groups, but we have 6 acute hospital regional groups that right across the country for adult services, and then 1 paediatric hospital group. So we will have reports for the adult hospitals in terms of what the key issues are per group, and then individual hospital reports. All of this will be available on a dashboard which hospitals will be able to look at, do some more thorough analysis themselves, and this is all expected by the end of 2017. The national report will be short, succinct, accessible, just will be of broad interest to the general public and the media, will identify key areas of interest and focus for patients that they've identified themselves as priority issues. The kind of things that patients want to know more about now is how they're treated in terms of their own care pathway, how they're involved in the decision making about their prognosis, about their care plans, their care pathway, their prognosis and so forth, that they're heard and listened to, that their options are presented to them. Those kind of really important issues are coming to the fore more and more. Whether people are treated with dignity and respect is a key driver for people's positive experience on the ground. So we expect to hear more about those kind of issues. These are often reflective too of concerns where if dignity and respect is low, it's also reflective of staff burnout on the ground. So we need to look at it in a very holistic way when we're looking at the solutions for the issues that come out. So national report on the key findings, hospital group reports which will give us the key particular issues which are important in the different geographical spaces, how the individual hospital groups are going to respond to supporting their individual hospitals with the issues that will emerge. So they will be of interest to the hospital managers at local level, funders at local level, and where we have patient councils at local level. So in Galway, for example, there is a patient council working in the Galway city area. They are consulted on about big issues which matter to patients in that area. The same thing in Limerick. So across the country, different areas are engaging with patients in innovative and creative ways, and they will use these results to harness the discussion and lever improvements for their spaces. Individual hospital reports will not be published. This is because the results for the individual hospitals will be about looking at what the key findings are for their areas, but taken in context with their local issues. So they will be about looking at what are the key issues there, and then how do they need to translate those findings together with the other information emerging from incidents or examination of complaints. A dashboard will be available. It will look something like this. It will give you kind of an overview of what the issues are. This is a sample dashboard which is used in New Zealand, where they group the issues relating to patient experience by needs, patients' needs, how their care was coordinated, so smooth transitions between hospital and community services, whether patients felt that their care was delivered in a partnership approach or where they were listened to and heard, and in terms of communication, how they were communicated with. They're the 4 key issues in New Zealand that are looked at in terms of patient care. So they present this information in this way so that you can take a quick look and you can see very quickly areas where people need to improve on or where they're consistent right across the system. So we will be looking at this in a rigorous way, combining this and triangulating this data with analysis of complaints from services, looking at critical incidents where things have gone wrong, and looking at how we translate this in general. And looking at it in a way that really, I suppose, drives quality improvement from a demand-led approach. So it's not just the services looking at what kind of quality improvements do we need to make, but it's about what have patients said that the quality improvement issues should be through their feedback about their experience. And over time, we will be able to come back consistently, measure the experience again, and then show the changes in trends over time, and have very sort of focused interventions and improvements, which where we will demonstrate the improvement. So this is just, for example, an example of a case where they've taken something like communication and shown over time how they were able to improve it. So we'll be looking to do something very similar with the results here in Ireland, and then use the results to demonstrate the differences between locations or hospitals at local level and national results. How do hospitals compare with their colleagues across the country or similar services across the country? Staff can often feel that this is going to give all of the negative stories about what's going on in the system, because when health services are profiled in the media, it's mostly the negative stories that come to the fore. But every day of the week, very positive experiences are. It's a mixture of patients having very positive experience, as not disregarding the fact that people have negative experiences or very poor experiences as well. But it's important to recognise that there's balanced, and I suppose that this survey will give very constructive and balanced feedback on what's actually happening on the ground. So the survey will be used, the findings will be used to look at the key issues, to sit down and plan to develop quality improvement projects from that, in partnership with patients and with staff at local level, and to implement those action plans. The quality improvement plans that arise out of these findings will be published, and they will be published on the website patientsurvey.ie. Where is it again? www.patientexperience.ie. So the quality improvement plans will be published a number of months after the survey findings have been published, and this is to give the services an opportunity to respond to the findings and then to sit down in partnership with patients to plan the solutions and to publish those quality improvement plans. So that will be happening at the beginning of 2018. And so there are the 2 contact details for this work. There's Tracy in HICWA and myself in the HSE. Thank you very much for your attention.